Hello, today we are going to study about the ruminal tympany. What is ruminal tympany? Ruminal tympany means bloat. Ruminal tympany is an abnormal distension of the rumen and reticulum caused by excessive accumulation of the gases of fermentation, either due to increased production of gas or physical obstruction of the process of eructation of gas. प्रोडक्शन ऑफ गैस इंक्रीज हो जाएगा तब रूमिनल टिम्पनी शो करता है, और इरेक्टेशन ऑफ गैस, ऑब्स्ट्रक्शन ऑफ इरेक्टेशन ऑफ गैस, देन ऑल्सो रूमिनल टिम्पनी अकर. रूमिनल टिम्पनी मीन्स excessive accumulation of gas in the rumen or reticulum. What is the cause of this primary tympany? Excessive intake of green pasture or leguminous bloat. This is called leguminous bloat. Excessive intake of greens, that is leguminous food like lucerne, alfalfa. Grazing of green loss pasture bloat. Excessive intake of immature leafy leguminous plants, leguminous bloat. Large intake of immature cereal crops, vegetable crops, cabbage and potato, etc. First point. Then second point, feeding of large quantities of grain, that is feedlot or grain bloat. Excessive intake of soluble carbohydrates, excessive intake of left over like roti, chapati, boiled rice, mostly that is the carbohydrate food. Less intake of dry refuges, lack of fibrous feed. And fourth point is the sudden change of feed. And fifth, that is the individual susceptibility. It may be secretion of small quantity of saliva. If the small quantity of saliva will be secreted, then the food is not properly mixed and there is the disturbed in the fermentation process and then production of gases will be increased and it accumulates in rumen and reticulum. Difference in composition of salivary protein, motility of rumen and rumen structure, process of cellulose digestion. These are the 5 most important points you have to remember for primary tympany. Secondary tympany. Here in primary tympany, frothy bloat condition seen. Frothy bloat. In secondary bloat, oesophageal obstruction, that is choke, due to foreign body stenosis, pressure from enlargement outside the oesophagus. Here the gases, after forming up gases, it is not going to eructation of gases is disturbance in the eructation of gases from rumen. It causes the secondary bloat. It is a different type of cause is there, that is the oesophageal obstruction, vagus indigestion, diaphragmatic hernia, traumatic reticuloperitonitis, reticular abscess, tetanus, anaphylaxis, allergy, decreased muscle tone, hypocalcemia, milk fever, decreased muscle tone, diseases responsible for decreased tone and motility of rumen and decreased rumination, unusual postures like lateral incumbency. What is the difference between the primary tympany and secondary tympany? Primary tympany, it is due to excessive production of gases. Secondary tympany, it is due to failure of eructation of free gas. Failure of eructation of free gas. You have to remember this. Failure of eructation of free gas, secondary tympany. Primary tympany, due to production of excessive gases. And primary tympany, it is dietary in origin. It is the most important point. It is dietary in origin, occurs in cattle on legume pasture and in feedlot cattle on high grain diet. It is because of physical obstruction in the process of eructation of gases. It is usually frothy type blood. Yes, when there is a frothy blood in questions, then we have to write the primary tympany, frothy blood. It is usually frothy type of blood. It is usually gaseous blood. It is usually peracute to acute in nature. It is usually subacute to chronic in nature. There is a difference. Now we can go to the symptoms. What are the symptoms? Enlargement of abdomen, particularly in left flank. Yes, left flank, that is the enlargement is seen in the left flank, that is in paralumbar fossa. You can see it is seen like enlargement, and there is a drum like sound at the percussion time. At percussion you can listen a drum like sound, that is the tympanic sound. Okay, we can study. Dullness and depression, abdominal pain, grinding of teeth, kicking at belly, rolling on ground. Yes. Dyspnea, extension of head, neck, protrusion of tongue. Yes. Respiratory and heart rates are increased. Yes. Cyanotic eye means blue eye. Blue eye mucous membrane you can see. Ruminal motility is initially increased and atony in later stages. Ruminal motility is initially increased and atony means no ruminal motility in later stages. Frequent defecation and urination, passage of scanty feces, sometimes diarrhea also seen. Tympanic sound on percussion, tympanic sound means drum like sound. Crepiting sound on palpation. On trocarization means using trocar in cannula, only small amount of gas will be passed in frothy blood. Yes, and huge amount of free gas in gaseous blood. On trocarization, I will show you the picture later. Line of treatment. What is the treatment we can provide at the bloat condition? Withdrawal of food and water. Yes. To reduce the pressure on diaphragm, keep the animal with its anterior portion at elevated position. We have to keep the animal in a elevated area. Here the head of the animal, head of the animal on elevated area. Okay, like this. Tie wooden stick on mouth to promote salivation. Trocarization of rumen with trocar cannula or large bore needle to give relief from gaseous pressure. That is the trocarization method. Pass stomach tube or probang. It is the important probang to remove gas from rumen. In gaseous fluid, you have to proceed this process. Give carbonatic mixture comprising turpentine oil 30 to 60 ml, sweet oil 400 to 500 ml orally as drench. Give 500 ml to 1 liter liquid paraffin or sweet oil to adult cattle or buffalo. Give injection oxytetracycle, that is antibiotic 15 to 20 ml intraruminally, here intraruminally, or tablet terramycin, staclin at the rate of 4 to 6 orally. Yes. Give antihistamine also, injection Avil, that is a different type of brand name, Avil, cladistin, antihistamine, and JIT at the rate of 5 to 10 ml IM. Use Blutosil dimethicone suspension at the rate of 50 to 100 ml as drench in frothy bloat. Blutosil, that is another brand name, Afanil, that is dimethicone suspension. And then 12 point, correction of ruminal pH and cord transplantation also method. Exploratory surgery, that is exploratory ruminectomy or laparotomy in severe condition. And massage, we have to provide massage of left flank. You can see here the picture. see it is in bloat condition, and this is the left flank, it is in a large condition, it is in severe bloat. Here you will know easily that is this is the stomach of ruminants. Here are the food and the gases. The gas, this region will be more. If it is the gaseous portion will be more, then there is the tympany or bloat. Here you can see that is the mild bloat, because just it is started, and it is the moderate condition, moderate bloat. Here is the severe bloat. Okay, thank you to all.